Hello, everyone, and welcome to Air Dialogue's panel on mental health during COVID. I'd like to extend a warm welcome to all of our speakers here today and our audience on YouTube Live. Please, those who are viewing on YouTube, if they could please like and share our page, it's greatly appreciated. So I'd like to start with just firstly a short introduction of our organisation of Air Dialogue. Air Dialogue was established in Dublin in 2010 as a sister charity to Dialogue Society. Our aim is to advance social cohesion by connecting communities, empowering people to engage, and contributing to the development of ideas on dialogue and community building. Air Dialogue aims to facilitate dialogue on a whole range of social issues, regardless of any particular faith or religion. We stand for democracy, human rights, the non-instrumentation of religion in politics, equality, and freedom of speech. Today, on our panel, we are looking at mental health during the COVID pandemic, and in particular, the effect it has had on non-paid carers. Recent studies have shown that the pressure of balancing work and family life during the COVID-19 pandemic has taken a substantial toll, particularly on women's well-being, with record numbers have been reported to have suffered with anxiety. Women's informal care role in the home has accelerated this, with stresses related to family well-being and finances often being at the source of this anxiety. Coinciding with this, it is estimated that there are almost 67,000 young people in Ireland aged between 10 to 17 years old who provide regular unpaid care for a loved one. New research has found out that young carers tend to have much higher levels of depressive symptoms than those of a similar age bracket who do not provide such care in their home. The government recently has announced a 20 billion national service budget plan as the largest ever. However, senior officials have warned that urgent reforms are still at the mercy of the COVID-19 uncertainty. We are unsure if this plan will be helpful for unpaid carers. Accordingly, this panel aims to draw people's attention to these carers in Ireland whose mental health may suffer more during the pandemic and discuss constructive and practical solutions who may help them. Firstly, I would like to introduce Bernadette Grogan, who is the Policy and Research Manager at Mental Health Reform. Bernadette, welcome.
Thanks so much, Ronan. Delighted to be here this evening, and it's so weird only talking to the panelists and not seeing who's out there. So hello, everyone. It's lovely to be here. I am a geek, so I prepared some slides for this evening. So the panel have kindly agreed that to let me go first. So I'm going to tell you a little bit about mental health reform and kind of put some of the pieces in context. So I'm going to do the usual of, can someone give me a thumbs up and let me know if you can?
Yeah, we can see that. Yeah, okay. You can see it.
Yeah. Brilliant, thank you. And I'm going to minimize it, so it's only my little head in the corner there. I also don't have like Martin Rogan's lovely branded, pull up behind me. So so this is to give you a bit of a flavour for mental health reform and the work that we do. So really delighted for Air Dialogue to contact us and invite us to speak this evening. Just before we start, any conversations that we have around mental health can be difficult for some people. You might be going through a crisis yourself. You might have someone in your life who's going through a crisis or, just a difficult time. So just to say, any of these conversations can be triggering and upsetting, but this is a safe space for everybody. And, there are a lot of supports out there online, so I'm actually really glad that I get to kind of open the panel discussion with this, and feel free to step away from the conversation at any point if you need to. So who we are, Mental Health Reform is Ireland's leading national coalition on mental health. Our vision is of an Ireland where everyone can access the support they need in their community to achieve their best possible mental health. And we're an umbrella coalition, so we have over 76 members, and across those membership we have organisations who work with people in housing and homelessness, with people in addiction, with people, refugees. We have the National Women's Council, so I'm going to focus on the kind of the unpaid carers and females. And we do, our work is around policy development and lobbying and advocacy and research. So I am going to refer to some of the resources that we have, because Air Dialogue have said that sometimes the people who attend these sessions might be working or researching in the area. So I might be able to give you some tips to some good pieces of work that have already been done. And yes, so these are some of our members, and I'm sure many of you will recognize a lot of the logos and that we have there. So and this is our associate members as well. So I'm going to be referring to some of them, particularly St. Pat's and Louise O'Leary, their advocacy manager there. I just realized I normally set an alarm because I could talk here all evening, so I forgot to do that. So give me a nod when I'm getting up to time. So I'm going to start with the kind of the practical solutions for mental health, for unpaid carers, for everyone who needs access to mental health services and supports in Ireland. Our three key priorities are investment in mental health support and services. Like, we know that the waiting lists are too long everywhere. People should be able to get the help they need when they need it. We have been calling for a national leadership post in the HSE that reports directly to the CEO, to join up all of the pieces across the spectrum. Like, for example, you could have some areas and community health organisations where they manage their waiting lists really well, and they link in with the community and voluntary organisations in their communities really well. And then there are others that, you know, it might be a bit of a postcode lottery about the services and supports that you get. And we know that in mental health, that's it's a crisis moment, and if you're getting the proper support, you should be able to mitigate those more devastating things that you can go through. And I suppose looking at this through the lens of the unpaid carers, you know, you're already caring for someone else in your life. So there's that saying of, you know, you can't pour from an empty cup, you know, that you have to have supports yourself to keep yourself at a place where you can care for others. And then one of our other priorities that kind of, it does link in with access to mental health supports and services. It's the reform of the Mental Health Act. Really exciting time for political nerds. This is happening now after we've been waiting a really long time, and at the end of this year and next year there is going to be reform that will bring our legislation into a more person-centered, human rights compliant place. So some of the work that's happening, I mean, I want to be really positive, but a lot of the research that has come out since the start of COVID has shown that people's mental health has been impacted by the pandemic, and in particular then there is a gendered aspect, and when we're looking at unpaid carers, we know that the majority of women undertake the role of unpaid carer across Ireland. So there was the COVID-19 Psychological Research Consortium, which is not a mouthful at all. So they've been doing some research since the start of the pandemic, and we partnered with them on Wave 2. And I mean, you know, stuff that we would kind of, you know, you'd know anecdotally that like people's mental health was impacted by COVID-19, that you were more likely to have depressive disorders, you know, you were more likely to be in crisis and not have the access to the supports that you needed. So for example, in part of their research, they had shown that 1 in every 6 people, if they already had a mental health difficulty, they got worse or they remained with poor health. Now, I don't want to throw loads of stats and facts and figures at you, but the Central Statistics Office did a piece as well in February 2021, and 4 in 10 reported low life satisfaction, and 17% of women reported that they felt lonely all or most of the time, and this was during COVID, and that compared with 9.2% of men. women were more likely to have lost their jobs in the pandemic. So even if you were in a part-time caring role and part-time working, you know, and maybe the work was your social kind of outlet, you were more likely to have lost your job. So there's an economic, a socio-economic aspect to all of this as well. In May 2020, we partnered with the National Women's Council, one of our members, and did a survey. So there were almost 1,500 women surveyed. 85% of them experienced an increase in caring responsibilities. So we had, you know, homeschooling, caring for family members while working, caring for elderly care, and childcare as well, when a lot of the childcare was closed down. Part of our work in mental health reform, we have this innovation team, and we look at e-mental health and digital mental health. And one of the pieces of research that we did said that females were more likely to have mental health apps. So maybe like Calm, or, you know, there's some kind of mindfulness and relaxation apps or apps that you can use to try and manage your mental health. So even we were getting that those results that women were reporting declines in their mental health and their supports, but then also that, you know, that they were accessing online help, and they were more likely to attend remote consultations for mental health. When we did our piece with the coalition's conversations as well, so we did the paper, but then we also had an online session like this, where we had some of our female members presenting papers that they had done around carers and particularly female carers. So some of the pieces that Louise O'Leary and St. Pat's had told us about was that women are 3 times more likely to be in unpaid domestic and care roles. That was pre-COVID. Women have higher rates of self-harm, and we know that the frontline workers, you know, in the health service, 70% of them were women. So again, when you think of unpaid carers, it's very often you're doing it alongside other work or study that you're doing, particularly talking about younger carers as well. You might still be in school or college. So between childcare, homeschooling, the increase in domestic violence, it really was kind of a storm of just awfulness for a lot of unpaid carers. Just to touch on family carers, Ireland also did a survey. They surveyed over 1,000 people, 95% of whom were women, and 60% of those carers were worried about the decline in their own mental health. This is just some of our contact details. I could go on, and I do have more points that I want to make, but I'm going to click out of the presentation and keep going for my last couple of minutes, if that's okay. There are a lot of conversations happening around carers, around women's mental health, around mental health in general. Next week, there's going to be a new bill published. It's the Assisted Decision Making Capacity Bill, which is going to change how people with disabilities, the decision supports they have. So this is a big piece that's coming down the line that's going to have profound changes for carers as well. So if you're caring for someone and you assist them in their decision making and advocate for them in the services that they access, there's a lot of changes coming down the line as well. So I'm going to stop. I think I've probably gone near my 10 minutes. I think we're going to have some questions and answers and a bit of discussion at the end. So I'll be quiet now. Thanks very much.
Well, thank you very, very much, Bernadette. It's brilliant to see that so much work going towards, and absolutely about the update of the reform of the Mental Health Act. That's huge. And I felt that your point about that you can't pour from an empty cup is dead right, that people who are dedicating their lives to helping other people, they need to be looked after as well. Brilliant. Well, then I would just like to move the mic on to Martin Rogan then, please, next, who is the CEO of Mental Health Ireland. Martin, if you don't mind.
Thanks, Ronan. Thanks for the invitation to participate, and to all the members of our dialogue as well. I think, as Bear has said, we're very proud as Mental Health Ireland to be one of the founding members of Mental Health Reform, and very active in relationship there as well. So it's a really great organisation, and I'd encourage people to get involved there as well. So I think it's probably important just to kind of lay out in terms of the scenario in terms of COVID, and like it has been a hugely unsettling and anxious time for everybody. So just needs to be said. And in fact, to be anxious, it's an unpleasant feeling, but it's designed to be a protective feeling. So it basically keeps us alert, make sure that we take extra precautions as well. And we know that the risk of COVID itself, particularly for carers themselves, but also the added burden and the added responsibility they felt in terms of supporting an individual who might be vulnerable, might be immunosuppressed, or might even be in cocooning. So but add to that, unfortunately, the huge precautions that was required and absolutely necessary from a public health point of view in terms of social withdrawal and cocooning. And we know that the things that can protect our mental health, because we had a large number of calls to Mental Health Ireland from people who would normally describe themselves as enjoying good mental health, and suddenly found themselves in a very different place, or kind of shifted in some way. So the things that people naturally include in their lives that either accidentally or purposefully by design, things like social connection, things like being involved in your local community, be that through sport, or could be, Tidy Towns Committee, could be a choir. When these scaffold poles were removed, people who had found this a very new space to be in terms of that suddenly their level of anxiety, their level of depression, and certainly the level of social isolation and loneliness had an extraordinary corrosive effect. In March 2021, we worked with Red C and we did a survey on homeschooling. And we did the survey quite deliberately in terms of as it was light on the horizon as the homeschooling period was coming to an end. But certainly we found quite a disproportionate effect on terms of families with younger children, juggling, working from home and childcare and becoming educators as well. And it was trying to coordinate all of these different elements, but particularly when people felt that the supports that they would naturally enjoy and depend upon themselves had been withdrawn from them. And obviously for good reason, but at the same time, it was quite a harsh but necessary public health measure. And I think probably to echo Bear's point, it's take the aviation equivalent is, attend to your own mask first. But if you're a carer, you often find yourself in the position of trying to support and encourage and cajole and to support the person, your family member, it could be a close friend, and particularly you're not feeling that for yourself. And it's interesting, when COVID was coming over the horizon in March 2020, we had an opportunity to work with some US leaders on this. And one of the things they described, even for paid carers, for professional carers, one of the great challenges is this is coming towards you. There's a huge level of building anxiety about that. And they were describing these people work in environments where, for example, it could be a huge climactic tragedy. It might be a school shooting, it might be a terrorist event. And they're describing that when you're traveling through a really difficult situation, even though time can become elastic, but you know that this is time defined, that within 24 hours, the dust will have settled, you can withdraw, you can decompress, and you can spend time with your family, etc. The big challenge with COVID is we didn't know how long it was going to be. Initially we went into this thinking this might be a fortnight, maybe it might be a month, then it was 2 months, then it stretched on. Here we are 2 years later. And we are inclined at the moment to talk about COVID in the past tense, and hopefully that's the case, but I think we all are being a little bit cautious around that. But if you're a carer, you need to know, particularly where other supports that you can depend on, other respite programs, access to primary care, access to a whole range of different supports, if they suddenly get withdrawn, or indeed if there's a possibility that some of the supports that you avail of can actually become a transmission from an infection point of view, that's hugely unsettling. And we know that sense of isolation can be quite crushing for people. And Vivek Murthy, who's the former Surgeon General in the US, his research was just of the extraordinary both isolating effect and undermining effect of social isolation and loneliness. And we know that many unpaid carers, and I think as Bear said, this is often gender imbalanced, can find themselves in an extraordinarily lonely space. Just somewhere that they can take a breather, have some time, have an uninterrupted night's sleep, and not always have to put themselves second. In Mental Health Ireland, our role is to promote positive mental health and well-being across the whole community and also support people in recovery. And we know that many people who had existing support needs found these supports were withdrawn, and that was unfortunately necessary as staff were redeployed, etc. But it left a lot of carers feeling in the lurch and overlooked. And I think sometimes carers can see themselves almost as a secondary person. There's the index service user, and then the care is almost an afterthought or some sort of a facilitation or some sort of a life support system, but that their needs can become can become secondary, and there can be a degree of invisibility that comes into the mix. And again, that can be a huge challenge if you feel you're not being validated, not being recognized, or not even being responded to. So again, extraordinarily corrosive and quite damaging and limiting for the person's own mental health. Over the last year, we've worked very close with HSE, with mental health engagement and wellbeing, and we've recruited over 80 staff of people with lived experience. And when we describe lived experience, we include people with direct experience or direct family experience. And this has been a really powerful piece, because people who have been supporting family members, particularly family members with mental health needs, have insights that I, from my own background, for example, is my professional background is in nursing. It's quite a narrow perspective. And what's been really helpful to us is that by working in co-production, where every aspect, every single project we do includes the experience of people with lived experience and of family members and of other content experts or professionals as well. But I think what has been really, really potent in that mix, and I'm conscious this is Air Dialogue we're talking to this evening, is taking a trialogue approach, where you bring those perspectives and each perspective is equally valid, equally valued and valorized, so that there's fair time, fair expression and recognition of sometimes unique experiences, but each experience is valid and needs to be heard. And when we can bring them together, we get a much more sustainable, much more beneficial effect. So certainly we've seen over the last 2 years, a significant dent in terms of our confidence. It's been interesting, and I suppose, people have had very different experiences of COVID. There's almost, I'm not sure if you've encountered this yourselves, but we're encountering almost a sense of lockdown nostalgia from some people as well. For many people, they enjoyed the different pace, the working from home, the not joining the commute in the morning, etc. But there tend to be the minority viewpoint. As social animals, we need to be connected, we need to be involved, we need validation, we need to regulate, and we do that through our social connections. So in Mental Health Ireland, we promote a 5 ways to wellbeing approach, which is about connection, to keep learning, to stay in contact and notice things, to give, and carers do that at an extraordinary level, and sometimes to the point of exhaustion, and also to keep learning. So these techniques are really useful. And another model we also promote is CHIME, and CHIME is about choice, hope, identity, meaning, and empowerment. And I think events like tonight and a discussion like this evening, I think can be really, really powerful and empowering. So let's not labor this, because I think the questions and answer session might be a really helpful piece. But I'd encourage people to visit our website or check us out on social media at mentalhealthireland.ie. Thanks, Ron.
Brilliant. Thank you very, very much, Martin. Very, very insightful. I thought that your point about how the fact with homeschooling in particular, but the unpredictability that no one knew when COVID would end, it's only when you kind of take a step back and maybe put ourselves in the shoes that we once were like, yeah, you're always asking your question, like 1 more month, 2 more months. And when you're in a caring situation and you're under pressure like that, not knowing when it's going to end could be particularly stressful. But thank you very much, Martin. So finally, I'd just like to introduce Jared O'Brien. Jared is an accredited EFT practitioner. He's an experienced motivational speaker and a mental health advocate and life coach. Jared, whenever you're ready there.
Good evening, guys. Thanks very much for the invite. I really appreciate it. The average person lives to the age of 79. That equates to 692,350 hours, the average lifetime, which equates to 27,365 days. That's not counting the time we sleep or recreation, when we're eating, whatever the case may be. And most of us spend our lives worrying, in fear, living with anxiety and depressive states of mind that has been created from past experiences and events that has molded us into who we are in the present moment now. But a lot of people don't realize this, you see, that when we look back at things that have happened to us, let's say, give me a child to the age of 7 and I'll show you the man, because we're like sponges. We take everything in and we pick up an awful lot of things from the people that have gone before us, and we accept everything as a truth, unable to question it at the time when we're younger. So we can bring a lot of trauma from the past into the present moment, which is now through teenage years and relationships, unable to process what has happened in the past because we don't have the tools. Now, I have a tool called EFT, which I came across about 15 years ago. It's called EFT stands for Emotional Freedom Technique, and it's also called tapping or meridian tapping, where we tap on particular acupressure points on the body that activates the energy body or the meridian system. And what happens when people are anxious or they're stressed or in depressive states, you have cortisol being released into the body for one thing. We start to get scared and fearful, but when we start to tap, we send this kinetic energetic chain to a little part of the brain called the amygdala, which is responsible for the fight or flight response. And it's also partially responsible for the processing of emotions. So when we're feeling stressed, okay, and there's lots of stresses today that activates the amygdala. For instance, okay, there could be a breakup in a relationship and we're very stressed. We start to get anxious. We're worried that the boss is going to shout at us tomorrow because we haven't got the portfolio ready. Stress starts to come upon us. So again, this is the amygdala starting to kick into play, but it can be stemmed in a moment, just like that, by tapping. With this energy, it starts to de-stress us straight away. It starts to unclog subconscious beliefs and energy blocks very, very, very fast. I've done this on 5-year-old kids. This has been introduced into the United States, to schools. It's been introduced to the Vets Association in the United States. It's been introduced in schools in the United Kingdom. And I've been banging on doors here for years, to be honest, to introduce EFT into schools. When you can imagine if there's kids being boisterous and they're bringing problems from home into the classroom, and the teacher is trying to get some order in the class, if they were to just turn around and say, kids, we're going to do some tapping. Now, I know this is all new to you guys, but you can check this out on YouTube yourselves. It is profound and it is so effective, it defies logic. So I'm using this platform tonight. As I said, I'm not here to sell myself, but I'm here to tell the people that are listening here this evening that there is a simple tool that can make such a profound difference in your life. It defies logic. Okay, so I'm saying that the carers and everybody else out there that's listening tonight, who were you before you became a carer? Who were you before you became a husband or a wife or in a relationship? You were you, but you forgot who you were. You forgot your I amness. You forgot all about yourself. And we start living in the fight or flight mode most of our lives. We're on high alert all the time. Again, EFT tapping can bring that down. So what I would suggest is get back in touch again with who you really are. I am. So I would pose the question to the carers, who's the most important person in your life? I would pose to everybody here on the panel, who is the most important person in your life? First thing that most people would say is, wife and kids, sure. Wonderful, I commend that. It's my wife, sure. Fantastic. It's my husband, fantastic. When somebody asks me, who's the most important person in my life? I am the most important person in my life. Why do I say that? Because if I don't value who I am, if I don't believe who I am and my self-worth, how can I expect anybody else to believe in me or give myself to everybody and anybody wholeheartedly from a loving heart? It's not egotistical, it's not selfishness, and it's not vanity. It's of paramount importance that everybody that's watching this tonight starts to believe in themselves again, like they did when they were kids growing up, when there was none of this mental trauma and everything else that goes with it. And things can start to shift. When you shift and you start to change the way you're thinking, you get what you think of, whether you want it or not. So be careful of what you think of, because energy follows thought. You get what you, okay. I get what I think of and I get what I say. Constantly, energy is following thought. You get what you do, energy follows thought all day long. So change it up, change it up, change it up, change the dynamics, do something different. If you've been doing something the same every day and you're getting the same results, albeit negative, what do you have to do? Change it up, do things differently. If I always do what I've always done, I will always get what I've always gotten. What does that tell you? Okay, I need to change. I need to change the way I'm thinking. I need to change the way I'm looking at things. I need to change the way I believe in myself or how I perceive in myself, and not worry about what other people think about me, because other people's opinions about me are not as important as my opinions about myself. When you start to delve into yourself and your own psyche and your subconscious mind, and you connect with the true essence of who you are, things start to change, because you start to empower yourself. And when you change your attitude, then you can start to discipline yourself. Then you can start to do things differently. And then you can start to be proactive, because anything can be changed. I don't care what anybody's going through in their lives. with the right mental attitude and the right emotional states and what you believe in yourself, what you instill in yourself, what you say to yourself, what you think about yourself, you will become all day long. It's up to you. Nobody else can do it for you but you. You can change your mental and emotional state like that once you start to make that change. And always remember, when you are complaining about the small little things in life, when you're wasting your breath complaining about the small little things in life, somebody out there is taking their last.
Thank you very much, Jared, for your points. I haven't heard of EFT before, and it's really fascinating the techniques that people can use to bring calmness over themselves in moments of stress and anxiety. And absolutely, I was and you're dead right that people need to look after themselves, particularly carers. That a lot of the time carers will put themselves entirely into the caring role and maybe neglect looking after themselves in some aspects. So thank you very much for your piece. So I would just like to then ask the panel there, if amongst yourselves, if anything has been spoken between Jared, Bernadette or Martin, that either any of you would have any questions for each other or any comments that you would like to make on anyone else's presentation.
I think it's really useful to have a number of perspectives here, and I think as Jared laid out there, I suppose oftentimes people sometimes have a go-to tool they use. I suppose we tend to encourage people to have a utility belt of choices, a range of different options. Sometimes they're passive and relaxation, some they're about exercise, sometimes they're about getting out and about. And I think perhaps sometimes when we narrow in, we're inclined to have a go-to tool that we sometimes overuse and then sometimes lose confidence in. So I think it's about having a range of options that you can choose from. Or in the same way you might have a range of a group of friends, some people you might go to if you had a relationship issue or a financial issue, etc. So it's like a diet. It's about having a varied diet that you can choose a number of options and move in and out between them. I think the point of each of us, I think, have made is about self-care. And I suppose, it is really important to make the point, it's not about being egotistical or selfish, but sometimes for a variety of reasons and life paths, etc., people can find themselves being defined and perhaps entirely defined as a carer and introducing themselves as such. And I suppose for people, particularly for caring for an elderly family member, etc., it's what's beyond that as well as what's before that, in terms of how do we make sure that we keep balance and that we still enjoy the caring and it doesn't become burdensome, intrusive, or indeed resentful, and that can become really corrosive for the individual as well. So I think it's self-care is in balance, but I think people who are carers often find it very difficult to do that, or even physically to make the space to allow that to happen as well. So I think it's about being imaginative without being imaginary. And I think particularly over the last 2 years, a lot of the little islands of respite that people enjoyed to keep their wellness and keep their calm and keep their compassion shrank. And now that we're beginning to re-emerge, I suppose we just need to be conscious that people are re-emerging at different points and different levels of comfort. We're meeting people still with masks in shops and wherever. And I think people are being very respectful of that and just allowing people to re-emerge and accommodate at their own pace. And I think that's a really healthy sign of a society that's become a little bit more insightful and a lot more understanding.
Yeah, I agree with what Martin is saying. I think there's so much awful stuff around the pandemic, but one of the things that has brought us is mental health has been at the forefront of political discourse. It's been in the public so much where we've thought a lot more about minding each other and minding each other's mental health. I think what Martin was saying as well around the 80 people who've been employed with lived experience, like it's so important to listen to people with lived experience and learn from people who've gone through it. And when we're talking about carers and mental health difficulties, people will recover and come out and then maybe carers themselves and they'll have gone through the systems and the supports around them and can bring absolutely brilliant insight, and it's really like the work Mental Health Ireland are doing is amazing. Just on Jared's points, I think a couple of things. I had heard about EFT and the different breathing techniques, and I think it's, as Martin said, I think it's really important to have like a utility belt could all be going around with like our MacGyver belt of tools. I'm showing my age now, but I do think we can't shirk away from the policy responsibility and the governmental responsibility of having the infrastructure and the supports in place. You know, like if you don't have access to the carers allowance or to a respite grant or to low cost or free counselling for yourself or for the person that you're caring for, if you don't have access to whether it's inpatient care or art therapy, occupational therapy, speech and, you know, so I do agree that there are a number of free techniques that we can learn, and like that, you know, some of the work we did through our innovation team, you know, we can show that, and there's apps available. But I definitely think I wouldn't like to see that the conversation around personal responsibility take away from the underinvestment that we have in mental health. You know, Ireland only spends around 5.2% of our overall health budget on mental health. The World Health Organization recommends 10%. And Sláinte Care, the target is 10%. We're only halfway there, and we're still, you know, completely overwhelmed. Our services are overwhelmed, and there are some really great people working in the services, who also need to look after their mental health. And we did a report as well, so of our members, it's called Brave New Connections report, and it mapped out the different supports that our members give. And I think there was over 200,000 hours in a year of a low cost therapy, kind of talk therapy. So for the not the severe and enduring mental health difficulties, but for the mild to moderate. So there's a huge amount of work been done by the community and voluntary sector, but they also need funding from the government to be able to continue to provide the services where they're needed. So that's my little hobby horse.
And Jared, any questions?
Yeah, it defies logic what's being spent on mental health in this country on an annual basis. It's just not right, number one, you know. But here I am trying to introduce something for quite some time, especially into schools that will take so much pressure off that governmental bill at the end of the year. It could save them tens of millions, literally. And I know this is new to you guys, you know, but I've been doing this for a long time, and the results through EFT with my clients, it's incredible, you know. So the way I'm looking at this, if you could implement such a simple technique that can be taught to a 5-year-old in less than 5 minutes, that could have such a profound difference on their mental and emotional health. It's a win-win situation. But I believe if children were taught how to deal with their emotional states at a very young age, there'd be very little mental health issues today, because they stem from childhood, the majority of them. So have a think about that, and you know, if you can maybe push this in whatever direction, because you're the guys that really have the power up there that can get something like this into schools. Or, you know, I'm not just saying me, there's other good people out there, other energy therapists and stuff, but I tell you what, there's nobody banging on doors like I am with this, because I've seen it happen right in front of me in real time. I've taught this technique to many carers that are using on their disabled children, their elderly parents and everything else. And they've come back to me and they said, "Jar, this thing is incredible, man," you know? And I said, it's crazy, isn't it? It seems silly. It seems like a silly thing to do, but boy, what a difference this makes. You know, it alters the mechanism of the brain. It creates different neural pathways in the brain. It you know, drops cortisol levels, as I said. It lowers blood sugar levels. It's a win-win situation. The list is endless. Harvard University have done, I don't know how many scientific trials on this, and they're still blown away with it. So I'd urge you to please just have a look into EFT therapy and maybe get back to me and see what you think about it, guys, you know.
And Jared, when you said, who's your favorite person, is it okay that I thought of my dog?
You can call it whatever you want. That's your preference. That's your preference, you know what I mean? There's nothing whatsoever wrong with that. But as you could see when I was talking a while ago, guys, I can't help it. I get so passionate when I'm talking, you know. And I come from the heart. I don't come from the head when I'm speaking. And, you know, I don't want to control the way I come across, because that's me. I'm very transparent and really passionate about getting this out there.
Well, thank you very much, Jared. Well, I'll just look at, I've been given a couple of questions here that have just been asked by members of the audience and of members of their dialogue. So firstly, Martin, I have a couple of questions for you. How do you feel that as a society we should look to overcome the stigma of mental health problems? That can you think of any ways that maybe we can move forward and move past that?
Yeah, I think I suppose, despite my youthful looks, I've worked in mental health for almost 40 years, and we've kind of gone from a place where this was an unmentionable taboo topic, not spoken about at all. We've seen the pendulum swing maybe a little beyond the sweet spot in terms of where mental health is infused through lots of conversations, and that's highly appropriate in most instances. I think sometimes it might be misused occasionally as well. And I think when we're talking about stigma, and it's interesting talking to some international colleagues where they've had large anti-stigma campaigns. For our younger generation, just last weekend on Saturday, I met with the Dublin City, Corlin and Og. And if we start using the language of stigma, they're saying, what stigma? Am I supposed to be embarrassed about this? So a younger generation have a much more mature and sensible and rounded and a better level of understanding. And that's understanding in the technical sense, but also in the empathetic sense. And they're inclined to think of mental health as a spectrum that doesn't just happen to other people, but it's about all of us and all of us together. So I think but a lot of stigma in this space can be self-stigma. And I suppose one of the core features we see in lots of mental health needs around anxiety, depression, eating disorders, psychosis, is that the person's own self-worth and self-regard can collapse to the point where they often feel they don't deserve support or don't deserve affection or friendship from people around them as well. So stigma can often be, and like most of us are very open-minded on a range of topics until it's my topic. So I think it's really important that we develop services that are accessible and appealing and attractive. And I think it's also important that a key part of our work is in promoting awareness and the availability of recovery, because stigma tends to be associated with things that have a poor outcome. So we remember in the past when people didn't use the word cancer because the outcomes were poor. TB, HIV, single parenthood, a whole range of different phenomena had heavy stigmas because the expected outcome was weak. Most people who develop significant mental health needs will recover. But oftentimes people won't necessarily declare that maybe 2 years ago they were in huge difficulty. And I think certainly for carers, that sense of being overwhelmed, that's absolutely okay. That's a completely human response to a situation that's perhaps unremitting or has been hugely challenging. So I think, asking for help, finding help and accepting help, and these aren't all necessarily linear or the same thing, but I think it's really important on us to have a range of options that people are comfortable to go to. We know that about 35% of all GP visits in Ireland every year, it's about 6 million visits, relate to a mental health need. So stigma is beginning to abate, but we're not quite there yet. But I think conversations like this are really helpful to give people new insights and to make it okay to have this conversation. And it can be challenging, it can be difficult, it doesn't lend itself to a soundbite, but it's a much more hopeful conversation than it's ever been before.
Just jump in there,
that actually had led on to quite the next question for you, which was the advice that you could give maybe to unpaid carers, like what steps that they could take if they are struggling.
Yeah, so I think it's really important in terms of looking at all aspects of your life. We know, for example, in a whole population, and this is not just people who have additional demands like caring, about 16% of the population enjoy good mental health. About 54% have sufficient mental health. And that means they cope most of the time. About 20% of people will have a diagnosis and be in treatment. And then there's another 10% of people who are described as languishing. And languishing means life is difficult, challenging, often conflicted, but not necessarily ill or requiring treatment. The fascinating thing about these studies, and they've been repeated all over the world in developed countries and emerging economies, etc., is when you come back and survey the same group of people 10 years later, you find that same profile, that same curve, that distribution, but the membership changes. So people move up and down. So it's really important to say, if you're feeling overwhelmed today, that doesn't mean you're stuck there or that you're in a cul-de-sac. Sometimes you need to reverse out of a cul-de-sac, but sometimes you can go forward and learn from that and extract experience from it. So certainly we would encourage people to use the 5 ways to wellbeing. We have a lot of resources on our website, some really useful materials. If I was to give a very simple one, and particularly as it relates to COVID, and we made downloadable posters for this as well, is if you can imagine what we describe as our area of concern, and sometimes this is visualized like a fried egg, so the white of the egg is the area of concern. These are things that impact on us, worry us, etc. Within that is a smaller space, which is our area of control. And these are things we can actually usefully have an impact on. And these are things like personal health, diet, space, exercise, breathing, sleep patterns, etc. And we know that caring can intrude on many of these, but as much as possible, if you can control these. We've certainly seen as a whole population in this part of the world and beyond, we found ourselves being involuntarily cast in a new disaster movie. So we've gone from COVID into a conflict in Ukraine, and also a lot of younger people in particular have great concerns about climate, and so climate anxiety as well. So I think sometimes we can find ourselves fretful and worrying and watching the media, watching the news, etc., which is often driven for drama. But maybe we need to come back in and just say, okay, what's within my gift? What can I usefully do? And if there's one aspect of my life I can take control of, and absolutely reaching out and saying, I'm not coping particularly well here. I need some extra support. And that can be from a friend, a neighbor, a voluntary organization, or indeed state services, as Bear described as well. So I think it's really important to know your limit, know your crumple zone, and don't allow yourself go there. Just say, okay, at what point do I raise a flag and say, at this point I need help, and not wait till you're in crisis, try and intervene earlier if you can.
Absolutely. Okay, thank you very much. I have then a question then for Bernadette. How can people on the ground who are interested in mental health services bring about positive change at government level? How can a layman or someone who's not involved with policy analysis or anything like that, what effect can they have?
This is a brilliant question, because I think sometimes people can feel really disempowered and that we're not being listened to, but we can all affect positive change. So depending on depending on your constituency, for example, the Minister of State for Older People and Mental Health, Mary Butler, is from Waterford. So if you're based in Waterford, like if you get to know your local TDs, your local representatives, the councillors, go and talk to them about the services that are available in the area, raise the issues that are coming up, particularly now in the lead up to budget time. So we'll be working on our pre-budget submission that we do every year, highlighting where some of the gaps are or where the priority areas are. But every single person in a constituency has so much power, because you're the ones that the politicians listen to. And I think sometimes, particularly with carers or people with mental health difficulties, we can be too tired and too exhausted, you know, just getting through the days and keeping our heads above water to think, well, I'm going to write an email to my TD, or, you know, I'm going to call down to their local constituency clinic, because usually they do. And I think since COVID, you know, is kind of receding, a lot of our politicians are back in their communities. So yeah, like, find out who your local reps are, find out, you know, are they speaking on mental health services? Do they know what the issues are for where you are? So at the moment, so we have a subcommittee on mental health in the Oireachtas. The other day they were looking at eating disorders. They had Bodywise in. As Martin said as well, like there are so many resources online for you to have those kind of fact sheets and those priority asks. And, you know, if a politician says, oh, well, you know, I can't do anything about that myself, they can, because this is the time now where the budget conversations are happening, where the minister and her officials and all of the ministers. So this is the thing, you know, you'll have all of the competing budget lines going to Michael McGrath and Pascal Donoghue saying, you know, we need X, Y, Z but real life stories make such an impact. And I just wanted to say, sorry, in case I forget as well, that the other thing that's really good, a really good tool for us, is under the UN CRPD. So that's the UN Convention on the Rights of Persons with Disabilities. If you're a person with mental health difficulties, you have rights. So also psychosocial disabilities is what is known as under the UN Convention. We ratified that convention in 2018. So the state has obligations to make sure people with psychosocial disabilities have rights. So you can go to your politician and ask them for all these things. And if they're hemming and hawing, you can say, well, we're going to be up in front of the UN Convention now, the committee next year, and they're going to be asking what you've done around mental health. And we have rights under the UN CRPD. So that's a really good advocacy kind of tool as well. And we have lots of resources. We have an easy to read guide and video on our website as well.
Okay, brilliant. Thank you very much, Brenda. Now, finally, I have a question for yourself, Jared. How can one recognize the onset of mental health problems, and what early signs should they use to watch out for this? Like, what if people are, say, it's their first experience really going through something particularly difficult, anxiety, and what are the early signs that they can do to stop this from happening maybe early on?
You've got what's called an emotional guidance system. Everybody has one. And what that is, it tells you how you're feeling. So your emotional guidance system tells you how you're feeling. And based on the premise that we live in a vibrational-based universe, how you're feeling dictates how you are every second of the day. So when you get added that indication within yourself, within your emotional guidance system, it tells you you're either feeling good or you're feeling bad. So if you're feeling somewhat bad, your vibration is low. Okay, no, everything is vibration. I don't think I have to explain that to you guys. Everything is vibration. So our thoughts create our feelings create our emotions, and our emotions create our vibrational frequency. So what we vibrate out into the matrix, out into the field, out into universal consciousness, we bring back through the premise of the law of attraction. So what we're vibrating out indicates how we're feeling, and that's exactly what we're going to get back. So the emotional guidance system tells you if you're feeling down, you need to pull yourself up. So that's the first indicator. So if you feel that way, then you're thinking, there's something not right here. I'm not feeling right. I'm feeling a little bit anxious. That social anxiety is coming back again. What do I need to do? I need to raise my vibrational frequency. Only until then, it's going to change. If you don't raise your vibration, it's just going to drag you down. Unless you're consciously aware of how you're feeling and you're in tune with your emotional guidance system, nothing's going to change. The simple little technique, how you're feeling dictates how you're going to feel for the rest of the day. If you're down, pull yourself up. Do some EFT. Do some EFT out of it like that.
Brilliant. Well, thank you very much, Jared. I just have one final question that's just come in. Again, sorry for Bernadette. Just what steps can unpaid carers in particular take when seeking, say, formal support or care? Like, who can they directly reach out to?
So I suppose it depends where you are and what supports are available in your community as well. You know, what services you have. We know that there are some places where, you know, they're completely without services and access to supports. I'm a big fan of the annoying our elected representatives about the things that we need. And you do, I mean, carers there's so much respect for carers around the Oireachtas. There's always speeches about unpaid carers, family carers, you know, the value in talking about how valuable and how important unpaid carers are to the economy and to the society is always recognised, but it's not necessarily followed up with. I suppose starting with things like maybe speaking to your community welfare officer or the Department of Social Protection about what your rights are, you know, what you might be entitled to as you know, financial supports, or like that the respite grant if you need the person that you care to be looked after somewhere for a week so that you can have a break and look after your needs. So I think starting off to find out what entitlements you have as a family or as a person is always a good place, because sometimes you have to go looking for these grants and help. You know, someone doesn't come knocking on your door saying, here's our suite of supports for you. So, you know, if you don't ask, you don't get, and it's definitely better to ask. And there are advocacy organisations, like there is Family Carers Ireland, and then depending, you know, if you're caring for someone with a severe and enduring mental health difficulty, there probably is an NGO or a community or voluntary organisation that works specifically in that area. So like Shine do a lot of work with schizophrenia. They were formerly known as Schizophrenia Ireland, or like that, getting in touch with Mental Health Ireland or ourselves to say, look, this is my situation. Where can you signpost me? There is a lot of, we all want the same things. We all want better supports and services for people to not be suffering with mental health difficulties, and for carers not to feel like they're alone. So if it's not us, or we don't know where we can point you, you know, we'll certainly try and pass on to someone who can help.
Perfect. Okay, well, thank you very much. So I would just invite all the speakers, if they could just have literally one sentence of a closing remark, because I'm afraid we're a little bit pressed for time. So just firstly, Martin, just one last piece just to sign off, if you don't mind. You're muted, Martin, sorry. Yeah, sorry about that.
Apologies. We thought we got past that. I suppose just one final point on the conscious, if there's many carers listen to this, I suppose one comment for me is huge thank you, because you know, our community, our society is always based on our ability to respond and support people at a vulnerable time, and that can be a family member, that can be a friend, it can be a neighbour. So I just say, you know, on behalf of all of our board and our volunteers right across the country, the whole network, there's an extraordinary debt of gratitude to be made to people who care, and I would just say, you know, we're certainly there to support you. And if, as Per has mentioned there, if there's anything you need or require or some signposting, definitely make contact with us. We'd be very happy to help.
Perfect. Thank you very much, Martin. If Jared, if you'd like to go next, just one line, a closing line, if you don't mind.
Yeah, it's simple. If you always do what you've always done, you will always get what you've always gotten. And if you always think the way you've always thought, you will always get what you're always thinking of. Change it up. Everything starts to change. Change your thoughts, change your life.
Thank you. And then Bernadette.
I'm trying to think of something really profound, but all I can say is, I suppose, you're not alone, and dog videos on YouTube will always make you smile.
Okay, brilliant. Well, thank you very much for that. For the last bit of wisdom there, thank you very much for so I'd just like to thank everyone for joining us. I'd like to thank our three panelists very, very much for joining us today. And just as a closing remark to all our YouTube viewers, if they could just like and share the video that comes out today. It's very important to share the awareness and spread the note around the issue of mental illness in Ireland, and don't forget to like and subscribe. So, and on that note, I'd like to say goodbye and thank you very much from our dialogue.
Thanks,
Thank you very much. Thank you. Bye. Bye.